I've come to see Dave. I've had a ACL reconstruction, second ACL operation. So I've come to start my physio. This is day one.
So yeah, we're just getting Ash's kneecap to move a little bit better. So obviously when you have surgery, all of the capsule around the knee joint tightens up a little bit. So all we're doing is we're just helping that to move. Now the scars are healing nicely and he's just got some ligaments that when the surgeon cuts through the skin, they can tend to tighten a little bit. So we're just restoring the mobility of the skin and all of those tissues to go through a full range of motion essentially. So just from doing that already, we're starting to get a bit more range back. He's starting to move his knee a lot freer, and that'll be the key thing over the first few weeks here now, is just getting that range of motion back. So I'm just adding some movement in here as I treat the capsule. So just helping that tissue to lengthen, just facilitating that and getting his hamstrings and quads used to working together again. Again, all of these tissues will just be stiff and just showing his brain it's safe to let go and to lengthen again. And you can see he's making really good gains already, even in this first session. You all right there, Ash? So I was just saying, even for Ash to be in this position now, it's just nice to be able to do that. And that's kind of the first milestone, because we can do a lot of good stuff now, because his hip, his knee and his foot can all work together again. So just pushing through that midfoot, Ash, that's as if he's about to bridge. You can see the hamstring gets to do a bit of work, his calf can do work, and you'll feel his bum muscles. So getting that connection from the foot, the knee and the hip, that's a coordination that we want to achieve, not only on the bed now, but when we get him in standing and hopping and running, that connection between the foot, the knee and the hip, that's going to be something that we want to fine tune over and over again. And that's something I see a lot, where people don't focus enough on that in the early stages of the rehab, and then in the late stages when they experience setbacks, usually when they come to us, we have to go back and fix these things. So we want to get these things sorted with him early on, so then he can keep progressing linearly. So push through midfoot again, mate, good. And even at that now today, in the first session, to get that back and that co-contraction capabilities around his knee, that's really important. So push through midfoot again, good. So as Ash pushes through here, what's happening is his hamstring, his calf muscle, and also his quads will still be working a little bit to control that knee. And again, in terms of a brace around the knee joint to give him stability, the hamstring, the calf muscles and the quads, that is a natural brace that the body has. So we want all of these muscles to do their job, so they protect the ACL ligament essentially. So heel, midfoot, toe. Heel, squash and orange through your toe. Squash and orange through the midfoot, squash and orange through the toe. That's it, keep your head up, trust your body, that's it. Now I want you to make that look smooth. So the key thing when we get a patient in for the first time with an ACL is we want them to actually walk as relaxed as possible. Because as I said, if the muscle is tense, the timing of the muscle is slightly off. So it's actually a very, very important thing that he can relearn how to relax and walk at the same time. A lot of people that develop emotional habits where they almost tense subconsciously, they hold their breath as they're walking. So what that sends a message up to the brain is danger, danger, danger. If we can get him to relax and walk, then that signal to his brain that it's safe for these tissues to actually take some load again, and we can restore the coordination and the actual action between the foot, the knee and the hip all together to work as a team. Okay, let's do that once more. Good man, that's low, better, mate. Emphasize the squashing through the toe, okay? So it's midfoot, and then I really want you to squash the pad of that little toe, or big toe I should say. So squash through the pad of big toe. See the way then that pushes the heel up? So it just gives that little kick. Good. Well done.
I think that's the difference. When I
push. That's it. Yeah.
I think that's what obviously I'm not doing.
So Ash, as he was walking there, as he was coming through, his leg was a little bit lazy. So we've just given him a cue now to squash the pad of his big toe as he actually pushes into the floor. So as he walks here, he's just going to push through the pad of big toe. And you'll see here what that does is that then initiates the lift of the heel, which drives the knee flexion. So as he pushes through the toe, that helps the heel to come up, which helps the knee flexion. So you can see how everything is linked. His big toe is actually very important to facilitate the knee flexion, to then put his body in a position and put his foot in a position for the next step. So we're just getting Ash to do some backward walking as well. That's great to stretch the calf muscles, but it also puts Ash in a situation that he maybe doesn't feel confident in. And then when he goes through this exercise, the confidence starts to build. Because again, a lot of people, they plan their movements every step, and we want to create that little bit of unpredictability in his rehab, because the real world is unpredictable essentially. So giving him that confidence to do things like this again, if he does need to do it in the real world in the next few days, he's being exposed to it. And we're also starting now to load his calf muscles, his hamstrings, his glutes in ways that he's going to need to do when he wants to jump and land again in later rehabilitation. So the first few reps with a patient, usually they're always rigid, okay? They're tense, they're feeling a little bit vulnerable. And then usually they go from rigid to relaxed. So that's when then Ash learns to trust his body and he starts to relax, and he's using actually a lot less energy to do the same task again. So that's going to be a key part of the rehab strategy, is to get the patient to move with energy efficiency, which is essentially use the right amount of energy, no more, no less. If we get that right in the early stage of rehab, then when we put the strength on top of it, everything goes a lot smoother. Good man, much better rep.
Yeah, felt it straight away.
And then push to that midfoot. Good, so knee forward, weight towards the heel, and then squash an orange down, push through. Good. Knee forward, weight towards the heel, and squash an orange, push through. Good. So what we're doing with Ash here is we're just getting him to put some load through his quad and his calf muscles working at the same time. So we're managing the foot pressure, so as his knee goes forward, the weight goes towards the heel, which keeps all of the load distributed evenly throughout the limb. If all his weight was on his toes as his knee went forward, then that's too much pressure through the knee joint for this part of the rehabilitation. So getting the relationship between the knee and the foot and getting the foot pressures to work well with the knee has a massive implication in where the load goes through the limb. So Ash is doing this quite early, or it might look quite early, but by manipulating the foot pressures, we can actually progress him on quite a bit, quite quickly. So that's all moving pretty well here now. So when he started today, he was struggling to get to 90 degrees, whereas we can just break 90 now, and we're getting quite a bit past it the more he relaxes. And a lot of that in the first session, it's almost Ash learning to trust his body again and actually relax. So a lot of the hands-on techniques and stuff like that, we're actually helping the muscles to relax rather than to actual strengthen them. And the more he relaxes, the more the joint is going to move, because as I said, the natural reaction for the body is to put too much protection in. So all of the muscles, when we get scared, we tighten, and that's the same with the muscles in the body. Is when the body's undergone a big operation like an ACL, the natural reaction for the body is to tighten everything. So actually a lot of the early stage rehab with an ACL is actually allowing the nervous system and giving Ash and his brain and his muscles permission to actually relax these muscles again, because the relaxation is really important for the timing of the muscle. So once the relaxation happens, that's the prerequisite for the muscle then to be able to react at the appropriate times, where if it's too tense, then when the muscle needs to contract, the timing can be slightly off. From my experience working with a lot of athletes with these issues. So a lot of the first session is actually about getting the relaxation of the muscle rather than the actual strengthening of the muscle, which obviously is important, but the actual relaxation has to come before we worry about the strengthening. So with this exercise here, as Ash comes back, I want him to really pull with the heel. So think about leading with the heel, Ash. Good, that's going to get his hamstring to work well. And now lead with the toe, push that toe up to the ceiling, okay? So the reason I want him to push with the toes, I want the connection between the foot, the knee and the ankle, okay? So again, that toe, by leading with that toe, that's going to stimulate all his shin muscles. So I want his shin muscles to work with his quad muscles, because that's how neurologically we're hardwired essentially, okay? So we don't want to ever isolate a muscle, we want everything to work together. So pull with your heel, pull, and then push with your toe. So always think about the intention is through the toe here. So he's getting a lot of quad, but the intention is actually happening at the foot. And that's usually what happens in real life, is the foot hits the floor first, and then there's the reaction up from the knee and the hip. Same with the hand. When we push with the hand, the shoulder reacts to the hand. So that's the way we want to train all of these muscles to work like they have to work in everyday life. Okay, and do one more for me, mate. You blown up? Tired?
Yeah.
Good man, good.
Checking it out.
Okay, good man. So the hamstring's very important for his ACL, but it has to work as part of a team for the soleus. So everything we do, we want all of these muscles to work together as a team. And you can see as he pushes, he'll get that little bit of shaking where his brain's almost trying to figure it out and how much of it to use. So we're almost trying to restore the Goldilocks approach. We don't want the muscle to do too much or too little. We just want to get it right. So this is just an exercise to allow Ash a chance to get that coordination right, and that really sets the tone for the strengthening exercises that we'll do with him in the next phase then. Whereas if we have all of this coordination right, when we put strength on top of that, then the athlete tends to go pretty plain sailing. When we miss this step and then they try to strengthen without this all being sorted, then usually, from my experience with athletes who have failed traditional approaches, that can kind of set them back a little bit sometimes. So we can see just from the start of the session, he's moving a lot easier now, and a lot of that, it's not just the hands-on treatment, but it's his own confidence. So sometimes the hands-on treatment can be useful because it can help the tissues and get him moving again. But actually a lot of this is just to have Ash's confidence to actually move his knee again is a big part of that, and that reassurance that it's safe to do that. And you can see it's freeing up quite a bit, so all that protective tone is starting to let go. So as he gets more confident, then all of that tone around his muscles tends to adjust as well. So it's very much confidence is going to be a big thing for him.
I was very nervous before we began. I knew, I've done physio before and I knew it was going to hurt. I couldn't move much, so I felt like I needed to come, but there was nothing, there was no movement, nothing. I felt so stiff to the point where I don't know, it's hard work. Yeah, now the session's over, I can't tell you how much better I feel after doing that, honestly. The movement I got in half an hour is just so much better than what I've had over the last 4 weeks. And 4 weeks of just sitting down with my leg up, and now I feel like I can actually start some physio and I can actually bend it. I was scared to do things, but now I'm so much more confident to start physio and get going again. Yeah, I feel confident with what he's given me because I wasn't sure what I'd be able to do. I knew that it was going to be very minimal, but what he has given me has made me confident, knowing that now I can actually go and do something, and what I'm going to be doing in the gym is right. I'm very excited, nervous but excited to come back again next week. I need to keep the physio going, but yeah, I'm very happy that I've come down today, even how nervous I was going to be.